second episode of the Leading Edge Clinic podcast. In our first episode, we had the opportunity to talk to some providers in a provider roundtable. We got to pick their brains and see how they treat patients, learn some success stories. And tonight we get to talk to three of those patients. What kind of symptoms brought them to the clinic? What treatments have worked? Which treatments may not have worked? How they feel about the conventional healthcare system, that ought to be interesting, and more questions. I'm your host, Mark Bishofsky, and I'm an employee at Leading Edge Clinic. I'm a medical freedom activist. I'm the founder of Stop the Mandate Minnesota, former candidate for Minnesota State House, and a practicing respiratory therapist who worked through the, shall I call it a scamdemic? That's what I'm going to call it. And it is an absolute honor and a privilege to be the host of this show. And like I said, tonight we get the privilege to speak to three current and past patients of Leading Edge Clinic. The purpose of tonight's conversation is to demonstrate the vast array of difficult and challenging medical experiences that so many people are having due to the infamous spike protein. So first of all, Abby, Brooke, and Christine, I want to say thank you so much for having the courage to come on and tell your story. And thank you for your time tonight. We really appreciate it.
Thank
And
you.
I'm going to, yeah, thank you. All thanks goes to you. So I'm going to jump right in and ask the first question. I'll ask Christine first. Can you tell us a little bit about your journey, your illness, the condition that led you to seeking treatment at Leading Edge Clinic? When did it start? What symptoms were you experiencing?
So in 2021, I was a city worker in New York City, and we were mandated to get vaccinated or we would be fired. So because my job provided medical for my family, we're a family of five, I had to make that decision. So I decided to take the Johnson & Johnson. It was one shot, and I needed to keep my job. So about 3 weeks after that, I started to develop neurological problems. I was fainting, passing out. I was slurring. My right eye would droop. I was having sensitivity to my ears. And that went on for a while. I want to say up until April, maybe, of 2022. Then I got better. I was able to go back to work. I did return back to work in May of 2022. And unfortunately, I got COVID from a coworker who had to work while she had COVID. So it was the first time I had ever had COVID. It was not bad, but then those symptoms became worse, and then I had other symptoms: mast cell, chronic pain in my body, my ears were worse, my stuttering was worse, my head was worse. And then I had to eventually quit my job because they told me if I wasn't able to work, I had to quit. So that I eventually had to quit in August of 2022.
Had to quit after being forced to take an injection. That is just so you had the double whammy. You had an injection and then got COVID. So many people had that experience. So
Yeah.
I can't wait to get into here about how you're doing now, but let's kind of hold back on that. So I think we'll go with Abby next. Tell us a little bit about your journey, that your symptoms that led you to seek treatment and kind of when it started.
It was very similar to Christine, actually. I was a federal employee. I was forced to get the vaccine. I really didn't want to. I have a bleeding disorder, and so I was very scared because of all of the clotting and internal bleeding problems that had been going on. And I called my hematologist, and they would not write me a medical exemption. And so, just like Christine said, it was either lose my job, lose my medical insurance, lose everything, or get the shot. And so, I got the Johnson & Johnson also. It was one, there was less of a risk of internal bleeding. So I thought, oh, I'll give this a try. I was okay for several months after that. until I got COVID from a friend. It was not her fault, but she didn't know.
Sure.
She wasn't exposed. I had COVID before. This time with this COVID was not necessarily different than the other times that I'd had it, just a bad flu. But afterwards, I mean, I couldn't stay awake. I was sleeping 22 hours a day. I couldn't get out of my bed. Everything on my body hurt. It ached. I started having these horrible episodes of vertigo. It felt like being on a carnival ride. And everything would spin. I was passing out. I didn't know what was happening. Very confused and very scared. Um, and the fatigue was just overwhelming. I would sit at my desk and try to work, and I'd just fall asleep and not even know what had happened. And I started having extremely low blood pressure also. Um,
Yeah, that is just, another double whammy. And I got to mention, since you brought that up about seeking the medical exemption, when I was working at the hospital at that time, I saw an internal memo that I probably wasn't supposed to see where doctors were threatened that they would get fired if they provided a medical exemption. So it was kind of this lockstep thing that was happening in the system where they just were not going to allow that, period.
Mm.
So unfortunate, but again, can't wait to hear your success story. And next, how about Brooke? What brought you to Leading Edge Clinic? What kind of symptoms were you having? When did it start?
Yeah, so in 2021, I had gone to Moab, Utah, and there I started experiencing a lot of heart rate issues, just a lot of like low blood pressure. We thought maybe it was like the elevation because I'm from Florida. Well, I ended up having COVID 5 times, and just the combination of everything just went really downhill. I was passing out, dizziness, fatigue. My heart rate would be 180 at rest. Um, I couldn't think. My brain fog was terrible. I couldn't focus in school. And it just really, I was bedridden. And so I had played softball and basketball. I was taken out of both sports I was going to play in college. I couldn't do that anymore. And so I got diagnosed with POTS, mast cell, and May-Thurner syndrome. And I also had long haul COVID. And so that's pretty much what led me to the clinic.
Oh, I'm glad you found us. So you were not vaccinated?
No, I was not.
Okay, well, that's a good thing. Yeah, so sorry. I mean, these experiences you guys are having, and that's a perfect example of it's not always the vaccine, it's the spike protein in the environment, and it's here for maybe forever. And I think we're all at an increased risk of these things and these died suddenlies and stuff like that. So I'm cautious too. It's a bit scary out there right now. So I'm glad you all found Leading Edge. I'm a believer in Leading Edge Clinic. So I think I'll go back to Christine now. So this is to me is kind of a big question. Did you seek care in the conventional system, and for how long? And um, were they able to identify the cause of your symptoms? I mean, what did they tell you? Were they able to offer you any help if you did seek help in the conventional system?
So, like the other young lady said, I had a problem also with blood pressure. My blood pressure was always 90 over 60. I was fainting a lot. I went to many doctors, and I'm in New York City. So a lot of them said that I had PTSD.
Sure.
A lot of them wanted to give me a script for antidepressants. I had several doctors that said I was not vaccinated enough, that I needed a second shot. So, what my husband decided to do with me was our last straw was in a hospital where they kind of said to me that they pretty much thought I was nuts. and that vaccines don't cause problems. But I'm someone with a 27-year-old son who had a problem when he was 1 year old with an MMR and got an exempt from the CDC. So he's never had a vaccine other than an MMR. And so my husband decided, you know what, no more doctors. So I did find a chiropractor that wanted to help with my vestibular issues, but was not able to help me with my other issues. So I used him for about 6 months until December of 2022. And I was really truly convinced I was dying. So we just kind of left it at that and we just prayed because we didn't know what to do. Now I knew of Dr. Corey, but I didn't know that he had a practice. That was something that was not out there at the time.
Yeah.
Um, and there were not other doctors taking care of people. Dr. Stella, she helped me to get ivermectin, but there were not doctors, making big statements like, come to us if you're sick and if you have, a vaccine injury. So
Yeah.
I
There
just
aren't
had,
many.
I had to just sit around in agony, and kind of wait it out. So that's what I did.
Yeah. So yeah, there are not a lot of doctors out there that will acknowledge that the vaccine or the spike protein can do this. And I really respect Dr. Corey for better or worse, for the patients out there, that he's not advertising, or shilling. And nobody likes that. I respect that in him. He's got integrity.
Does.
And he's focused on those. He's loaded. His patient caseload is maxed out, and he focuses on the patients he has and wants them well. And we're looking at adding another provider so we can help more. But how about you, Abby? What was your experience in the conventional system if you did seek help there?
So I guess my journey had been going on for a little bit longer. I had a lot of chronic health conditions and problems prior to all of this COVID, the vaccine injury, and then my long COVID. But I was really healthy, when all of that happened. It was really shocking, and I had never been so sick in my entire life. And so I felt blessed that I had already gone, I guess, doctor shopping and kind of had my, poor experiences prior to all of this. And so the doctors that I was working with were more open to listening to me and, alternative treatments and things like that. And so I felt that they actually did listen to my concerns. I mean, I remember going to my primary care doctor, and they wouldn't let me leave because my blood pressure was so low, and they were nervous. And so the nurse would come in and kept checking it over and over. And when are you going to be safe for you to drive home? And so I did feel heard, but I felt that, their hands were tied. My doctor, he was, would say, this is so new. We don't know what to do. We don't have any ideas. There's nothing that I really can do to help you with everything that you have going on. But he did believe that it was long COVID, and that, the spike protein was an issue. So I did feel heard in that way. And I feel grateful for that. But I think he was just at a loss for what to do.
Okay, how about you, Brooke? What was your experience if you did seek help in the conventional care system?
Yeah, so I saw a rheumatologist and a cardiologist for about 3 years. And I was even sent to Mayo Clinic in Rochester, Minnesota. And the only thing they could tell me was I had POTS and I had to drink more salt and more water. But salt and water only gets you so far. And I was getting IVs once a week of saline just to keep my fluid intake, which they said that it would keep my heart rate down, but it didn't do much. I was still nauseous, still lost a bunch of weight, and my body pain was still there. The only thing it really helped with was keeping me hydrated and leveling out my heart rate, but it didn't take away much anything else. And I was getting stuck with needles once a week, and it was just not good. And my rheumatologist was convinced I had Sjogren's or lupus because my mom has it. And so they did a lip biopsy. It was negative. My blood work showed my ANA markers were high, but everything checked out and said negative. But my rheumatologist was just stuck on it being an autoimmune, saying, here's some medicine to mask your symptoms, but it wasn't actually fixing anything. It was just kind of like a band-aid over what was happening. It wasn't actually getting me better, because if I missed my medicine for one day, I was back to not feeling well. So it was not the conventional system was not allowing me to actually live like a normal teenage life. Like, I couldn't go to school for the whole day. I would have to come home. And so we had to switch to Dr. Corey, because my mom had heard a lot of great things about him. And she worked some conferences at Children's Health Defense, and so she had met him as well.
Okay, excellent. So this kind of is a follow-up. Start with Christine again. And you kind of mentioned they said PTSD. Did they? I hear this so much when I'm answering the phone for new patients. They're told it's all in their head. They're having anxiety. You're crazy, trying to put you on SSRIs and things like that. Did you experience that, Christine?
Every time I went to a doctor, every time. So, like I said, my husband stopped it. My husband just said, we can't do it anymore because I think it's psychologically making you, I started to think, you know what, it's not the shot, I'm crazy. And but I was very healthy before the shot. I was running. I exercised. I'm 55 years old now, and I was a very healthy person. So for me to faint on the floor and start slurring and have neurological problems, that was a big deal, and no one would diagnose me. They really, every single doctor, even cardiologists. One cardiologist told me to leave his office. I wasn't vaccinated enough. He told me I needed 2 shots to come and see him. I told him the Johnson & Johnson is 1 shot. He said, well, it's not effective. And that was
That's
what I was dealing
insane.
with.
How about you, Abby?
I definitely think personally felt that I was going crazy at the time. I was blessed to not have a doctor tell me that it was, all in my head, but I think I was told a lot, nothing showed up on your lab work, nothing is showing up, there's nothing, wrong with you. And, but I knew that there was. I mean, I couldn't work anymore. I was falling asleep, just, sitting up. I couldn't leave my bed. I slept 22 hours a day. My heart rate was all over the place. My blood pressures were, just major dips, and completely irregular. And I knew that it wasn't just in my head, but when you're getting tested over and over and nothing's showing up, you start to think, is there really nothing wrong with me?
Yeah, that's so unfortunate. And Brooke, you kind of touched on your experience with the Mayo and things like that, but did they try to tell you it was all in your head? Was there any of that experience for you?
Pretty much every time I went, they told me I was a high schooler, that I had a lot of stress in my life being a teenage, teenager in high school. I would show up to the hospital, my heart rate would be like 170 just sitting. And they would be like, are you anxious to be at the hospital? And I was like, no, I'm here because my heart rate is so high,
Right.
not because I'm anxious. And they didn't really tell me anything. I had a cardiologist tell me that I was too complicated for him and that he couldn't help me anymore, and that he didn't know what was wrong with me. But kind of like what Abby said, like, they told me like it was just anxiety, but I knew my symptoms were so real. Like, this was not in my head. I wasn't making it up. I was an athlete. I would never not have myself play any sports. Like, I knew I wasn't making it up, but for no one to understand what you're going through, it was very frustrating, because it felt like you were crazy. And like, I was like, am I going to live like this for the rest of my life? I'm only 16 years old at the time. And so I was like, is this going to be the rest of my life if no one can figure it out?
Yeah, that's got to be scary. And I got to say, you're probably smarter than some of those doctors. You know, a lot of these doctors have a God complex and they think they know everything. And to
True.
put that on a young lady, that it's all in your head, that's atrocious. I'm so sorry that happened to you. So, by the way, I'm looking at the chat here. A lot of good questions. They want us to talk about shedding and stuff like that. We might touch on that a little tonight, but I'm sure we'll touch on that more in future episodes. Also, the comment, how to detox from the vax. Well, there's no one size fits all, and we're going to get into kind of some of the treatments which have worked. And I know at Leading Edge Clinic, the couple of years I've been here, that protocol has evolved drastically from what it used to be to now. Learning what works, what doesn't, and new treatments that have been tried are starting to work. So it's just a continuation, and I honestly believe our providers are the best in the world. But I'm going to move. Speaking of leading edge in that way, what, Christine? How did you find? And you'd mentioned you knew who Dr. Corey was, but how did you end up finding leading edge and realizing there was help here? And who are you treated by at the clinic? You've already said Dr. Corey, but those are the questions I have in front of me. So how did you find leading edge? How did you realize we were here?
So I was on Instagram and I was following Dr. Corey and Dr. Artis and Dr. Campbell and Dr. Cole. And I was also on the webinars for FLCCC. And when I was on the webinars, I was asking a lot of questions. And then someone on the webinar said to me, "Oh my gosh, you need Dr. Corey. Dr. Corey has a practice. You need to get in." So a whole bunch of other people started sending me his website, his phone number. Everyone was like wonderful, and so that was so. I want to say I finally got to call the office the the middle of February, and Nurse Karen answered the phone, and or maybe it was that I left a message and she called, and what she did was she said, we're booked. I can get you in maybe in March, and I just kind of cried my eyes out, and I just begged her. I said, I'll do anything. I'll pay anything. I'll do anything. I don't have I haven't seen a doctor in months, and I don't think I'm going to make it. And Nurse Karen, being the most wonderful human being that she is, she said, "Don't worry, doll." She said, "I got you." And then she called me back and she said, "I got you an appointment. There was a cancellation on February 17th at 11:30. You're in." And that was only a few days. So she was my savior. She got me in. Um, and then that's the official day I was able to see Dr. Corey.
Excellent. And Abby, you were, I think, one of Dr. Corey's first patients, one of the few first ones. So how did you find us? How were you lucky enough to find Dr. Corey so early on?
Yes, I feel so blessed that I found him when I did. I mean, honestly, the reason I agreed to this interview is that I know in my heart that with everything that was going on with my body at the time, and especially with my cardiovascular issues, I don't think I would be here right now if I hadn't found him and if he hadn't helped me. Um, I I was completely at a loss. And like I said, I was basically out of it at the time. I mean, I was sleeping 22 hours a day. But my mom, bless her, she's so worried and just doing all the research that she could. And she found some of Dr. Corey's, I think, interviews or videos that he was doing at the time, just talking about long COVID and spike protein. And she said, I think he has a clinic. We should call him and see if he'll see you. And I feel so grateful that he did. I mean, that even that very first appointment, I mean, he was the first doctor that said, I think you have POTS. I mean, all this time that I had, all of these blood pressure issues, all these cardiovascular issues, nobody ever thought it was POTS. And so he's like, I think you have it. I want you to track your blood pressures. I'm going to give you, medication for that. And I mean, just immediately just took me so seriously and, just helped right away. Um,
Yeah, great. He really is brilliant. Most people don't know. I mean, he was world renowned. He was a pioneer in critical care medicine. He was the top doctor in Wisconsin. And he's no slouch by any means, and he was just ostracized. I mean, but he is brilliant and compassionate. So I am so glad you found him. And Brooke, how about you? How did you find Leading Edge? I'm gonna guess your mom did some digging, or did you?
Yes. So my mom did a lot of work with Children's Health Defense and went to a lot of conferences. And so she had followed Dr. Corey all throughout COVID. And she ended up actually meeting Nurse Karen at a conference where she was like, this is what she needs. My mom had told her my whole story, all my symptoms, everything I'd gone through. And she was like, we can help you here. And so my mom was like, this is what we need. I've been following him. You're going to be in good hands. And India Scott has been taking care of me, and I still actually see her. And she actually just referred me to a vein specialist, and I'm getting surgery in December for a stent, which will hopefully alleviate a lot of my POTS symptoms due to a compressed iliac vein. So I'm still currently working with them, but India has been taking very good care of me.
Yeah, what a learning experience for you, Brooke. And India Scott's amazing too. All of our providers at Leading Edge are incredible. They really are. They all work together. It's like the best minds in the world, I feel like, when it comes to spikopathy, all like batting things off of each other and learning together so that they can help as many people as possible. And it's been such an amazing success so far. I think now we're going to get into kind of the meat of this, like what kind of treatments you've had that have been successful. So, and like I said earlier, it's definitely not a one size fits all thing. It's kind of a trial and error process. Sometimes really simple treatments work and people get better right away. Other times it takes a lot of digging and more advanced treatments. But each patient receives kind of a tailored protocol to their condition, and their medical history is taken into consideration, and goals that you have. Can you kind of describe, Christine, what your care plan is like, kind of how it was created, and was there some trial and error?
So Dr. Corey knows me as his guinea pig, and I'm very okay with that. So I'm completely in his hands. So we have treated my POTS. That's kind of gone now. I still have some neurological little issues, but certain things work very well for me. NAC works very well. Lithium works very well. Ivermectin is my go-to for shedding. Hydroxychloroquine. My mast cell under control. I see India and Dr. Corey because in this process, I had some very bad. I went in. I was in remission of thyroid disease. I relapsed. I suddenly have hormonal issues. So every protocol Dr. Corey has put me on has worked very well. And right now we're in a trial and error. So some things work better than others. I kind of know my body now. I'm very familiar with what's going on. If I don't feel good, I'm able to just lay down. I don't have to run to work. So that's something that, I have to live with right now, and I'm okay with that. But for the most part, I would have to say everything that Dr. Corey put me on was definitely a thumbs up. I definitely saw many benefits. And I also had the iliac vein stent put in January. It was an amazing process. The day after I had the surgery, my lungs opened up. I didn't even know I could breathe. I wasn't able to breathe. Who knew? I thought I was over breathing. I was actually having panic attacks over it because I couldn't figure out what was going on. But that was all, that was pretty successful. Right now, I am having some problems with my lower legs. It's probably just an age thing, but again, everything worked very well for me.
Great to hear that. And Abby, how about you? What kind of trial and error was there for you? Because again, you're kind of no longer being seen by the clinic. I think you're kind of a success story, but how much trial and error was there, when you started?
There was definitely a lot of trial and error. I definitely was the guinea pig too, but I didn't mind. It was just I was open to anything that Dr. Corey suggested and that he wanted to do. I mean, my biggest problem at that time was definitely my POTS. I mean, it was so debilitating, and I mean, we tried everything for that, and eventually he referred me to a clinic where I did all of these IVs and hyperbaric oxygen and apheresis and ECP, and he helped to tailor this protocol for me, and I took it down there and I said, this is what he says we should do. And I was there for a month. And after that, I mean, the nurse at the clinic had tracked my heart rate the entire time I was there. And I had regular blood pressures and a regular heartbeat by the end. I mean, it was amazing. I can't even describe what it was like. I haven't had POTS symptoms since.
Amazing.
Incredible. That is awesome. And how about you, Brooke? I know your treatment is ongoing, and hopefully you're feeling better already. But kind of how much trial and error has there been for you, in the creation of the protocol for your symptoms?
Yeah, so I still definitely am having symptoms, but I haven't been on the protocol maybe as long as like you guys have. And so I was completely bedridden. I couldn't get out of bed. I barely made it through school, but I this year was my senior year and I played softball. I had an internship and I went to school, which was like crazy. And I was on ivermectin. I was on ketotifen for my mast cell because I had lost so much weight. I was just throwing up every single meal every day. And so just it's been trial and error, but I've been on Sulodex side for my heart rate stuff, and I've been just hydroxychloroquine and a lot of stuff that you guys have said as well. That has helped a lot. And every time we meet with India, it's maybe we try this, maybe we try take this out, and so it's still an ongoing process. And hopefully, I'm glad to hear that your stent went well. That gives me a lot of hope that mine in December will hopefully go as well, because I understand what you mean by like not feeling like you can breathe, and so mine's still ongoing, but I'm hoping that it continues to go in a positive direction because I'm definitely a lot better than I was.
Maybe we can
Awesome.
talk about it one day.
Yes.
Yeah, we've considered creating a support group so that that patients can speak to one another about these kinds of things, because the rest of the world seems to not acknowledge this stuff. Um, Next question is kind of how long. I get this question. I'm a scheduler, office staff with Leading Edge, so I answer the phone when new patients call in, prospective patients, and I'm always getting asked, how long before I'll feel better? Um, how long for you, Christine? Like, you had your first consultation and started your protocol. How long was it before you sensed relief or felt a little better at least?
I think with the POTS, I felt relief immediately. But with my situation, Dr. Corey, we did one thing at a time because I just had so many issues happening. So I guess he didn't want to overwhelm me. I am a lot older, and my body kind of rejected some things at first. So we had to keep trying and pushing. Triple therapy was definitely something I did not think would work, and it did. My body loves ivermectin, so I'll be on it forever. I'm okay with it. It's a great thing. So I want to say to you that right now, I'm definitely not where I was in 2023. I'm able to walk and talk, and I go out to events. I'm able to do things with my family. I was not able to do it, so that's a good thing. But we still have maybe a little work to do. And Dr. Corey now just recently put me on ketamine. So I'm actually thinking that that is going to work for me. But I am a lot better than I was. I'm not in bed all day. I I'm able to do things like I wasn't able to. So I am much better, I believe, than I was then. I've come a long way.
That is awesome. And how about you, Abby? Um, how long did it take before you felt relief?
Um, like Christine, my POTS, there was immediate relief. It wasn't all the way better, but just the fact that it was being treated, that Dr. Corey wrote prescriptions for medications that, are even just traditionally used to treat POTS. So just to be on those made a world of difference. But it was several months before I went to I guess what would be a very drastic, very extensive protocol with all the hyperbaric oxygen and the apheresis and IVs and EECP and all of that. And so it was several months. And then, but like I said, after that, my POTS was so much better. I haven't been on any medications for POTS in over a year. I just haven't
Right.
needed them. That's completely cured. Unfortunately, I am still very, very ill, but I think that it got to the point where I found out that I had other diseases. I had Lyme disease, and so I had to kind of switch, I guess, tactics and try to find help other places. But I am so grateful again just to Leading Edge and to Dr. Corey for everything that he did. I mean, my heart is so much better, just permanently fixed, but definitely still a very very long road. um,
Yeah.
and but
Yeah, that's great. So Lyme, that's pesky. What a pesky disease. And I live amongst ticks and I worry about that. So we get a lot of inquiries because a lot of people suffer from that. So we are now, our providers are studying that. We've brought on an expert for Lyme. So we're soon going to be offering, in fact, we already are offering expert care for Lyme's disease with, that alternative naturopathic approach to get to the root of it and try to help people with that. So the care of Leading Edge is expanding. And how about you, Brooke? I mean, you're relatively new as far as a patient, so you had your first consultation, a care plan was created. Did you feel better day one? I mean, did you notice a change right away, or did it take a couple weeks, or kind of how was that initial experience?
It was pretty good. I think I've been with the clinic for maybe 8 months. And so I think it took me about a month to actually start noticing a difference, probably because I don't take a break in my life. So I didn't give my body a really chance to heal much. But I'd say after a month, I realized that my energy was back. I was able to go back to doing some things that I used to do before. Whereas in that period, I noticed like I could eat without feeling nauseous, and my heart rate when I just would get out of bed wouldn't make me faint when I get up or take a hot shower or anything like that. And so, yeah, it's been I think about a month that I started feeling relief. Um,
Okay. That's not too bad, really. And that kind of leads me to my next question, which is kind of a continuation of that. A lot of what I'll tell people on the phone is, we do have some patients that report they're 100% better after, the 4 months or whatever. That's pretty rare, I'll admit. I think, some people are bedridden, they can no longer work, and they'll end up saying, I'm 50 or 60% better, but I'm beyond satisfied kind of a thing, when you're that bad. Christine, what would you say at this point from, 20 before this all happened with the vaccine and the long haul, before that happened, um, and to now, like when you were healthy to now, would you say you've had like a 50% recovery, 70%? And what if you had to put a number on it, what would you say?
It's hard to, I'm able to function, so I'm good with that. I was not able to function when I was first vaccinated. Before that, I was, like I said, I was very healthy. So if I had to put a number on it, I'm going to say that I'm probably 85%. But since then, I've had some, like I have significant other issues, but they're not issues that make me debilitated. So when I speak with Dr. Corey and I'm in pain or I say I'm in excruciating pain, I'm a personality type that I could be dying on the floor. I'm still going to go out food shopping and take care of my adult children, clean my house, and do my daily thing. If I can work, I would go back to work. I don't think it's fair to an employer to have to deal with me calling out sick. So that's the reason why I won't do that. But I think that I am well considering where I was when I first saw Dr. Corey.
Yeah, I mean, if you put 85% on it, that's pretty darn good. It sounds like maybe some days 60%, 70%, but on
Right.
a
And
good
I
day,
do have, like I
85.
said, I have the ability to, if I don't feel good, I can just sit and take a break and lay down and rest and it's okay now. It's not something that I'm crying over or I think I'm dying. I'm not in that stage anymore.
Thank goodness. How about you, Abby? If you had to put a percentage on it, what would you say your recovery is?
Well, finger, like I said before, for my POTS, which Dr. Corey cured 100%. I don't have any cardiovascular issues whatsoever at all. I got exposed to COVID again a couple months ago, and that was the first time I had any POT episode in years. And there was only one, and I got scared, but I was okay. But just in terms of my overall health, I mean, I think that there are good days and there are bad days. Unfortunately, I am still disabled. I had to leave my job. I was forced out of it. It is got ugly, but and I haven't been able to return to work. But I don't live in my bed. I don't sleep 22 hours a day. I'm not falling down my stairs because of my blood pressure. I mean, there have been so many wins. And I'm here. I'm not dead. And anything is better than not dead, than living dead. So, and not dead is
Right.
much better. So,
I'm with you.
yes, exactly. So I feel grateful. And like I said, I mean, it's not just hyperbole and me just singing his praises, but I really do believe that I am here because of Dr. Corey and the work that he did. And I hope that I've told people, I've known people in my life that have come and they've had similar cardiovascular issues to me or similar problems, and I say if you can, try to call Leading Edge, see if they can help you because they're just so incredible. But I don't know about the number in terms of everything else that's gone wrong. A lot of things have gone wrong, but nothing that has to do with Dr. Corey. But so maybe about 50% overall. Unfortunately, I just didn't. I mean, with the plots, I feel so grateful, but with everything else that's going on, just haven't found what works for me yet, I guess. But
Yeah. Okay, great. And Brooke, I mean, considering you've got, I think, a lot of improvement to go, there'll be more treatments to try for you, plus your stent. So I'm sure you're going to improve a lot more. But if you had to put a number on it, now I know this is a tough question, but what would you say? 20%, 50% better,
I'd say
80%?
I'm honestly like 60% better than I was because I when I was super sick, I fainted on the softball field. My face turned purple, and out the whole summer. My friends would ask me to hang out and be like, I'm tired. Like, I just can't. Like, I'm literally in bed. You want to come over and watch a movie? But now I'm like, oh my gosh, let's go to the beach. Let's go on the boat. I am doing so much more. I'm able to actually do things 2 days in a row. Whereas if I had an activity on a Monday, I would need Tuesday to recover and actually get better and not have my body hurt and just actually get my energy back. But now I can do things 2 days in a row, 3 days in a row, and not feel near as tired and wiped out from an activity that I used to feel. Because I had an internship, I was able to go to school and work, whereas that was never the case before meeting with Karen in India. It was you either go to school or you go to work. You don't do both because you'll be asleep at your job or you'll be asleep at school. And so I think me being able to also play softball was huge for my senior year, where my coach actually saw me being able to run on the field again and not have to go lay down on the floor and put my feet up because my would be so dizzy. So I think I'd say it's like 60% better.
That's pretty darn good. Hopefully you get back to 100. I mean, yeah, going from not being able to play the sports you love to being able to, that's huge. You kind of got your life back. Still have some challenges,
Yes.
obviously, but I'd say you've more or less got your life back. Something to work
Yes.
with and continue to get better.
I'm hoping
Next,
after the stint. Oh, sorry.
go ahead.
I was going to say,
No,
I'm
you go ahead.
hoping after the stint that I'll be closer to the 90%, 100%,
Yeah, I
hopefully
mean,
after
based
the
on what
stint.
Christine said, maybe 100. Let's shoot for 100.
Yeah.
Why not? I mean, you're so young.
Yeah.
So yeah. Next question. This will be a tough one, I think. If you had to pick one treatment, I know there's a lot of treatments, a lot of different medications, supplements, hyperbarics, the stents, those things. If you had to pick one of those things that you think helped the most, what do you think, Christine? What would you say?
Oh gosh, that is pretty tough because
It's a tough one.
I love my protocols. I've actually recently, I believe I just mastered a shedding protocol, which I am going to share with Dr. Corey. I think I'd have to say, am I allowed to pick two? Um,
Sure.
I'm thinking, I like the way ivermectin works in my body. Um, when I don't take it, I know I don't take it. And I think the iliac stem, because I didn't realize that I couldn't breathe, and I didn't realize that I had such poor circulation after giving birth to my third child. So when I went to Dr. Spencer, I was in terrible shape with my veins. So I think that the stent and the ivermectin are definitely two things that I'm happy I've done.
Excellent. Thanks for that. And how about you, Abby? If you had to pick one or two,
Um, it's like Christine said, there were so many things that I did, and so many things that were helpful. But I would say definitely the hyperbaric oxygen and the apheresis treatment that I had, and then the many mineral IVs, and that there was just the entire protocol that he made. I mean, it worked so well for me. I unfortunately did not respond super well to ivermectin. It didn't agree with my body, so I had a lot of side effects when I was on it. And so, but bless Dr. Corey for trying so hard to find other things for me to do. And but I would say that I think that those treatments that made a huge difference. And EECP was huge, I think, for my for the circulation. It just like I said, the nurse tracked my heart rate every session, and it completely regulated itself. And so very grateful for all of those things.
excellent. In relation to this question I'm asking, I should mention that this is a reason why um, providers don't get super aggressive and throw everything at a patient all at once. Because for one thing, if you're having side effects, it can be easier to identify what's causing it if we start slow. And then another thing is we'll then know what's working. So that's an important thing to keep in mind, where they're not going to just be like, here's a protocol, one size fits all. We're going to throw it at you. It's listening to the patient. What are your symptoms? What is your medical history? And then it's really tailored to you. And then it's gradually escalated if need be. And then, so yeah, how about you, Brooke? Do you feel like there's one treatment or two that have made the most difference in your quality of life?
I think I struggled with nausea since before COVID, and I think that had to do with my mast cell. And so I think being on ketotifen um, and taking that every day really like controlled my mast cell and helped me be able to eat food without feeling like I was going to throw up or be nauseous because it made me lose a lot of weight. And so I had been dealing with that since long before COVID, since like 2018, 2017. And so I think just realizing that I can actually eat food again while being on ketotifen, but I know that when I don't take it, I can definitely tell the next day that I am just super nauseous and I take a bite of food and I feel full. And like people had mentioned gastroparesis, but I think that it really has to do with me taking the ketotifen every day. And that has been the biggest game changer for me to be able to eat food, get my weight back, and then probably Nepronol. I've been on that for a while, and that has helped a lot.
Yeah, I hear the ketotifen helps a lot of people in the whole mast cell activation syndrome. Scott and Pierre kind of discovered that was a big problem. And I should also mention too that a lot of, like, you came to us for long haul, but other conditions are being addressed. So, patients that come to us, it's not going to be just your vaccine injury or just your long haul. The goal is to get you well, get to the root of those problems, no matter what. In fact, we offer just what's called complicated medical care for folks that it isn't long haul. I mean, there's a wide variety of issues right now that patients aren't getting help in the system, and they come to us and we help them. With these brilliant minds working together, it's fascinating to be a part of it and to listen to patients and hear the stories of people getting better. It warms my heart. It really does. I work in the system, and still, unfortunately, from time to time, and I see what's happening, and these poor patients suffering and not getting the help they deserve. So it is sad. And that brings me to my next, good timing for the next question. Kind of our last question. I think the timing's great here. We've been about 50 minutes. So, um, you know, do you trust doctors anymore? What has this all done to you? Dr. Corey writes a Substack. His last one, one of his last ones was on nosocomophobia or iatrophobia, fear of hospitals, fear of doctors, which I have, even though I work in them. I mean, what has this last 5 years of being gaslit and lied to and told you're crazy and it's all in your head? I mean, do you trust the system anymore? I'm guessing the answer is no, but if you can expand on that, Christine.
I do not trust the system. I don't trust any system, actually, whether it's doctors or social media. The politicians, I don't really trust anything that anyone says. I've told Dr. Corey, he's my doctor for life. I will never switch. I will never use another doctor or another facility. I've made it very clear to him in India that I will not go to a hospital because they constantly gaslight me. And I live in New York City, so that is big here. I have no intentions. I probably will never have a mammogram done. I have other ways of, getting myself checked out. I'll never go to a gynecologist. And it's not because everyone is the same. I say that because my experience was horrific. And when you are sick and you are told that you have PTSD and you know that you don't, but you're falling on the floor, or your blood pressure is clearly not working. I don't know how anyone can ever trust a doctor again. So the answer is no. I trust Dr. Corey. I trust what he says. I trust Leading Edge Clinic, and that's about it.
Yeah, it's unfortunate. How about you, Abby?
I have to agree with Christine. Definitely, this whole experience. I mean, it just makes you want to lose faith. It's kind of in humanity, but especially in the medical system. But I think that it's these really brave doctors like Dr. Corey. I mean, he's so brilliant and yet always open to new things and to learning and to really listening and caring about his patients. I mean, it gave me hope that not all doctors are like this, and so I mean I definitely trust Dr. Corey and all of his partners in the practice and everyone that is out there really trying these more alternative methods and really just trying to break these terrible cycles that exist in this medical system. But it's really hard, I think, to go out there. I don't have a lot of trust, definitely in traditional medicine anymore. And when I think about myself and my own health journey, anything that helped me, it was from someone like Dr. Corey, someone outside of the system, and a more alternative treatment that, medicine isn't one size fits all. And I feel like most doctors out there that you go in their office and you present with these symptoms, and then if you don't, test, it doesn't show up on the test, or you don't respond to this treatment, they basically say there's nothing we can do for you. But thankfully there are people like Dr. Corey that say, okay, that didn't work. Now what can we do now? And so I just, this new system that they're building, I'm hoping will be better than the other one.
Yeah, what a novel experience to have a doctor actually listen to you. It's amazing. And Dr. Corey, his passion and compassion and his willingness, his bravery, I mean, he put it all on the line. He took a huge, huge risk and, could have lost everything. And I know he doesn't regret any of it, and he's very happy with where he is. And, Dr. Corey gets all the praise, but all of our providers are incredible. Scott Marsland blows my mind. We don't have any of his patients on the panel tonight, but that guy is incredible. India Scott, our new provider, Deb Moyer, is incredible too. She's bringing new thoughts to the practice. Chris Lee, treating cancer patients. They all are better because of each other, and I honestly don't feel like any of them is any better than the other, to be perfectly honest. But Brooke, how about you? What do you think of the system, doctors? I mean, do they scare you? I know for myself, if I don't have crushing chest pain and know I'm having a heart attack or have my leg cut off, I'm not going. That's how I feel. I mean, how do you feel about the system?
Yeah, I definitely don't trust them because they would tell me it's anxiety, it's depression, it's in my head, that's part of growing up. And I had actually went to Italy last summer where I was able to eat all the food. And it was because probably of all the chemicals they spray on our food here. And I came back and I told them I could eat over here, why can't I eat here? And they were like, you were in a relaxed environment over there, you were on vacation, now you're back in your life and you just can't, you just are stressed again. And I'm like, it's summertime, I'm not stressed, I'm literally in high school, I could eat this over there, but I can't eat it here. And they would just tell me it's a nervous stomach, and just told me anxiety, depression, and here's a medicine to take. But the medicine that I would take would cause other symptoms, which would cause me to come back. So it was just like a never-ending circle of they just give you medicine to mask one problem but cause another problem to keep you coming back so that they keep making money. So I definitely don't trust them. They are just trying to make you more sick so that they get their paycheck.
Yeah, unfortunately, I think that's true, and I don't think I'm going to give them a little benefit of the doubt. Like, I don't think they're trying necessarily. There are some probably that are evil like that. They have, big student loans, they have big houses, nice cars, they have a payment to make on all that. They care more about their lifestyle, I think, than digging deep and actually helping people. And I think it's an indoctrination from medical school, and like Dr. Corey can explain that very well. I mean, he was in that system, though he was more thoughtful and compassionate than other doctors, even in 2018 or whatever. But he understands, having been in that kind of indoctrinated mind to a certain degree. And so yeah, look at this, we hit an hour exactly. I don't know how that happened. We got very lucky. We didn't have any technical issues. Everything was great. You guys were amazing. And my heart goes out to you. I hope you continue to improve. Thank you so much for your courage and your bravery, for coming on and telling your story. It can't be easy. For one thing, dealing with these challenging health conditions, and then yet to speak publicly about it. So from all of us at Leading Edge Clinic, we're so grateful for you giving us some of your time this evening.
Thank you.
Thank you for having us.
Thank you.
Yeah, absolutely. And the journey continues, and I'm sure someday I'll talk to each of you again. And I'm going to click end this stream here. You'll still be in the green room when we're done. But like I said, thanks so much for tuning in to the Leading Edge podcast. We're so glad you joined us this evening.
Thank you. I hope you girls get better
Thank you.
soon.
Thank you.